So you start Retatrutide, maybe you're a week in, maybe 3 weeks in, and something feels off. The exhaustion is real, and your heart's beating way faster than it should. And, your skin may feel a little bit sunburned, and nothing's really touched it. And you're wondering, is there something wrong with you? Or is this just something that's expected with the drug you're on? See, I'm a Taza. I coach men over 30 who are done guessing and ready to actually fix their body. I'm not a doctor, but I've spent serious time studying under the best of the best of what this drug does, and I've worked with men that are going exactly through what you're experiencing. And I want to give you a real breakdown, not the version that skips Instagram or the uncomfortable parts, but the real raw version. Now, before we get in, I do also want to make clear, this is not medical advice. Please consult with a direct professional if you are considering this, because that's going to be necessary, as that's not my port of call. But before we get into the list, I need you to understand what Reta actually truly is. Retatrutide is a triple agonist. It hits GLP, GIP, and glucagon simultaneously. And most of the other peptides you might have heard of may just pull one or two of those levers. The thing is, Reta actually pulls all three. And that's why it works the way it does. But that's also why the side effects are a lot more intense than most people expect to be going on. And there's a lot of shared experience in the community now, like thousands of people have used it. This gives us a lot of real world data, which are a lot more honest than the pharmaceutical company typical volunteers. So we'll dive into them. Now I'm going to break down the 6 categories and I'll tell you what actually helps and what's actually real. First thing is fatigue. This actually catches a lot of people off guard. They expect nausea, but they don't expect to be hit by a bus. And here's what actually happens, because your body is literally being asked to switch its primary fuel source from glucose, which is fast, readily available energy, to fat oxidation. And that metabolic shift takes time and it's tiring. And add that to the fact that GLP, GIP, and glucagon all drive insulin levels down, which lowers your glycogen storages and starts to drop circulating blood sugar levels. And it's kind of gonna have an effect. And here's the thing that most people miss. Lower insulin actually causes your kidneys to dump sodium in water. So you're running a low blood sugar here. Low sodium, low hydration at the same time. So you are going to be exhausted and you are going to experience that, just so you know. Sleep disruption also compounds with this. It's not a separate issue because low insulin generally means your kidneys are shredding sodium, blood volume drops, your heart has to work harder just to keep you stable whilst you sleep. So your nervous system never really fully shifts into recovery mode. You just wake up way more tired than when you went to bed. The fix here, however, because it might sound all negative, by the way, which it isn't always, it's not to stop the drug. One fix is electrolytes, especially sodium. Double down on sodium, go to town with it, and water intake. And do not rush the titration, because most men, they push the dose up and they're usually suffering with this the most. But be patient with this, because it will massively help you with the things I just spoke about a second ago. Then you've got the GI side effects. You probably heard it. Retatrutide does slow down gastric emptying, and there's going to be side effects. Let's just be honest with that, like nausea, vomiting, constipation, diarrhea, bloating, acid reflux, sulfur burps, sometimes all at once, by the way. But here's the mechanism in the plain language. What Reta does, it just pulls a brake on your digestive system and it slows it down. GLP-1, which is inside Retatrutide, slows down gastric emptying, so food sticks in your stomach a lot longer and travels through your gut slower. This is why sulfur burps, which is basically just the hydrogen sulfide smell, is just food fermenting in a slower GI. It's not dangerous, by the way, but it's just, if you've had it, it's generally unpleasant. Dry mouth also is quite common because glucagon receptors exist in the salivary glands, and it's not fully understood, but it's actually real. So in this case here, these are to be expected. Your digestion is going to be slower, so you are going to get a few side effects. And it really depends on the dose, but there's a lot of things to expect here. What helps, however, because there's a lot of things you need to do with food and nutrition. Smaller meals, not drinking a large amount of liquids during meals. Maybe digestive enzymes if the burps are severe. Magnesium oxide at night if the constipation is a real problem. It's not during the day because it pulls water out of the gut and feels uncomfortable. And then keep moving. Exercise physically moves food through your GI tract, right? So training, walking, cardio, get what you need to get in. In this case, you may even look at your macronutrients and start to look at being more fat dominant rather than carb dominant, addressing fiber intake, addressing protein intake. You may lower it down to a minimum and the stomach is still going to move things forward, but not too high and excessive like some people may have. Then beyond that, you've got muscle and joint issues. Muscle cramps, joint pains, increased sweating, and the things that not many people want to hear about. The muscle loss. The cramps usually come back to the electrolytes issue, by the way, the sodium, magnesium, and the potassium all being depleted. And however, the joint pain is a little less understood. It's likely inflammatory, likely tied to the metabolic shift. And most men find it quite self-limiting. But coming back to the original point, muscle loss is a real concern. Any rapid weight loss will put your muscle tissue at risk. And muscle is literally the engine that keeps your metabolism running and keeps your shape intact. So if you are not resistance training, getting stronger, hitting a high protein intake, whilst you do this, you are going to lose a considerable amount of muscle you cannot afford to lose. It's metabolically taxing, so most guys that are on huge calorie deficits, not eating and not training, which is most guys to be fair, properly, they are going to have a lot of muscle mass, which is a big negative if you were trying to use it to look better, feel better, etc. So for most men, I'd recommend 1 milligram. So for most men in this case, I recommend a gram of protein or 0.8 grams of protein per pound of body weight, and that's a non-negotiable. And I also want to flag electrolytes here as a fix for mostly muscular side effects like the cramps, so like sodium, magnesium, potassium. I personally use Full Ball Sports, Dr. Dean's pineapple flavor. It tastes amazing, by the way. Perform is really good too. The coconut ones or cocoa is not bad if you like it as well. But I've recommended it to so many clients, and generally just protein, resistant training, electrolytes, it's non-negotiable. Then another thing that you may expect on Retatrutide is elevated resting heart rate, which is surprising most people a lot because the glucagon compounds of Retatrutide can directly signal your heart to beat faster. And research generally shows and supports an average increase of, let's say, 5 to 10 beats per minute. And some men even may run hotter or colder than usual. And so you see, glucagon is thermogenic and it activates brown fat and metabolism, which can raise your body temperature up than usual. In others, it might be like a mild fight or flight state, which causes your drug to cause, blood vessels to contract, which kind of like essentially can leave some sweats and a little bit of nausea like we spoke about earlier. So a lot of these things kind of go together, right? But on its own, a elevated heart rate generally isn't too concerning or too much of a red flag if you just give your body a bit of time, check hydration, electrolytes first. So then sometimes the elevated rate is just a hydration issue, not the drug itself or the compound. But again, which I've mentioned multiple times, magnesium biglycinate can help here massively with some ashwagandha potentially. Obviously looking at caffeine intake will also be something I'd look at here and reducing that. But red flags that do need medical attention: palpitations, irregular rhythms, chest pain, chest discomfort. These are things not to ignore, okay? So like, it's very common. Some things are not red flags, some things are here as well, okay? Then we've got allodynia, which is a side effect that I want to spend time on because men generally think something is wrong with them when it hits. Allodynia is when your skin starts to hurt, like from things that generally shouldn't hurt, by the way, like your shirt touching your arm, like light pressure on your skin, like a sensation like a sunburn without any sunburn happening. But the pain dial gets turned up. Right, and this happens usually because of glucagon receptors which exist in sensory neurons. Because when Reta modulates those receptors, it can temporarily lower your pain threshold. Your nervous system can become hypersensitized. So that is something just to look at because some may experience it, some may not. And like most men's common fix generally just reports back to dialing the dose back for a couple of weeks and slowly pulling that back up over time. Like most cases, this just resolves the issue. Fortunately, a lot of people try Retatrutide or the peptides or compounds just by using ChatGPT or Claude and think, all right, I've got a rough base dose without any other intervention. This is where things can go quite wrong, okay? So that's something to look at as well. Then obviously coming back to the gut health, gallstones and pancreatitis, I can never say the word, pancreatitis. Rare, but it's worth knowing that these are rare, okay? So these exist generally because, but they exist. And you should know what to look for. Rapid weight loss generally in any kinds whatsoever, with or without the compound, it will increase the risk of gallstones. If you suddenly get sharp upper abdomen pain, especially after a fatty meal, then get that evaluated. Do not push through that, get it checked out. The pancreatitis can carry, I fear, some risk with GLP-1 medications. The actual incidence, however, is quite low. If you're experiencing it, usually that can look something like a severe, unrelenting, like upper abdominal pain that radiates into your back, which only means one thing: it's go straight to the doctor. Do not use ChatGPT or do not try to figure this out by yourself. But those two are side effects on the list where I cannot give you the fix or recommendations, but you need to know that's not normal. Get it checked out. But look, I've kind of spoke negatively because I've made previous videos and I don't want to have a bias. Reta is powerful. That's the point. But powerful requires respect and it requires more attention and more awareness around it, right? And so if you're a man that's taking it, if you're a woman that's taking it, you need a proper framework with protein, with supplementation, with training, with electrolytes, sleep, and a realistic approach when it comes to using this properly. Otherwise, the experience can go awry and it's not what you want, okay? So like, strategy is needed. Do not go do it by yourself. And if you want to talk about how to build a strategy properly, with or without GLP-1s, you can reach out to me directly with so many questions, and I'm more than happy to answer them in the comment section or reach out directly. This is literally what I do every single day, so it's here to help. Okay, so if you find this video useful, thanks for watching, and see you in the next one.